So now, without further ado, I'm so excited to introduce our presenters for today. First, I'm going to introduce Leonard Jason. Leonard A. Jason is currently a professor of psychology at DePaul University and the director of the Center for Community Research. Jason is a former president of the Division of Community Psychology of American Psychology Association. Jason has edited or written 30 books and has published over 800 articles and 100 book chapters. He served on the editorial boards of 10 psychological journals. Jason has also served on a review committee of the National Institutes of Health, and he has received over $46 million in federal research grants. And now I'm also excited to introduce his co-presenter, Ted J. Bobak. Ted J. Bobak earned a master's degree from DePaul University, where he's currently a doctoral candidate pursuing a PhD in community psychology. His general research interests include substance use disorder prevention, treatment, and recovery, with a primary focus on recovery home residents, specifically those within the Oxford House organization. Ted believes that cultural diversity is a strength which lessens ethnocentrism and promotes building strong, healthy relationships through the recognition of one another's humanness. Currently, Ted is constructing social network models that will enhance our understanding of how individual recovery homes' social networks are created, maintained, and dissolved. So now, without further ado, I will turn it over to our presenters. Thank you both so much.
Thank you, Emily. Yes, as we started really working with this organization called Oxford House around 1991. So it's been over 30 years that we've been working with them. And you probably are wondering kind of who this group called Oxford House is. Well, they're recovery homes. They're people who have substance use disorders. These are places where people can go into these houses and basically stay as long as they want. So if they want to come in for a couple of months, if they want to come in for a couple of years, they have that option. So it's basically stable, permanent housing for those people who want to stay there and living in community with others. Each house is democratic, basically self-run. There's no professionals who are in the house or managing the house. The house is completely managed by the individuals in the house. And that's what was really exciting for myself and Ted as we began thinking about what are the possibilities of this innovation. You probably maybe never even heard of Oxford Houses, but they are all over the country. There's over 3,000 of these Oxford Houses. They're in Chicago, they're in Illinois, they're in every state of the union, and there are other places even outside the United States. They started in 1971 with just one house for people in recovery. 11 people were in a halfway house. Halfway houses are different in that you usually need to leave after a certain period of time. And there's not the same type requirements for democratic self-governance in halfway houses. So 11 people were in this recovery home, halfway house in the Washington, D.C. area. They lost its lease, and the guys in the house said, why don't we just continue to live with each other, and we'll basically self-govern. It'll be a little bit less expensive. And that one house came up with these rules. You could stay as long as you wanted. You have to pay your fair share, which is usually about $100. Some places it might be $120, $125 a week. And number three, you have to participate in the self-governing community. And this one house basically grew to about 15 houses, and then grew to a couple of hundred houses when I became involved with this movement. And now there's over 3,000 of these houses. And what that means is that there's thousands of people around the country, literally hundreds of thousands since 1975, that have gone through an Oxford House model. Now, the houses are a place to live. Basically, the people in the house it's like any other house. It's like 7, 8, 9 people. They're either male or they're female. Some of the houses have children, some of them don't. But the key thing is all decisions are made democratically. So basically, it's something where people decide that this is a place where they want to live and that they have a chance to elect their own president and different officers of the House to run the House. And everyone gets a chance to basically be part of this community. And that's kind of what's exciting for myself and for Ted, because we're very interested in these types of grassroots organizations that are trying to solve community problems in an inexpensive way. The houses are always rented. They don't own the house. And that makes it easy to spread this model. So that's kind of a cool thing, that the houses can really develop quickly as long as there's enough people that can rent the house. And basically the expenses are low. If you have 7 or 8 people, 9 people in a house, you can basically live there really for maybe $100 a person, $110 per person for a particular week. So a person can, in a sense, come into this recovery home with minimal resources. And often individuals have cut off a lot of their sources of support. The people in these Oxford houses tend to be folks who have had difficulties with the law because they were involved in substance use disorders. And because they're coming into these recovery homes, they have a chance to have a new social network, a new group of people, new in a sense way of basically being in the house. And I'll tell you a story of one person who I met from an Oxford house. And basically it was an individual who sort of said, basically it cut off all his sources of connections. His family wasn't interested in working with him anymore after having relapsed so many times. He basically didn't have any close friends, and he was really on his own. And he'd done a lot of stealing and other things toward people that were not good, and he had served time in jail as well. And he went to the recovery home, this particular Oxford house, and the Oxford House members interview a new resident coming in. And the Oxford House has to decide, we want you in as a member of our house. Each one's a community. So you have to get 80% of the people to say, we want you to be a member. And why do they want you to be a member? Because you really care about your recovery. You want to basically get out of the substance use addiction problem. So these individuals basically are trying to make a difference in their life. What did this particular person say to them? Well, went through his life, talked about the experiences. The House members said, you're ready to kind of make a change. And again, Oxford House individuals can have done anything in the past, and they're really ready for a second chance. And they said, here's the key to the house. You can have this. And the Oxford House person who had just been accepted said, you can't give me this key. Don't you realize I've cheated people? I've been a person who's done all types of terrible things. I've broken into houses. Please don't give me the key to the house. I just want to live here. They said, no, here's the key to the house. And finally, he accepted having the key to the house. And that changed his conception of who he was. In a sense, he's now part of a community. He's not exter. He's not sort of rejected by the community. He's part of the community. And that began to think of different terms of how he's going to relate to these people in this new opportunity for stable housing. 6 months go by, he does very well. And they sort of said, we're going to elect you to become treasurer. So they said, wait a second, you can't make me a treasurer. I don't want to have this position. Don't you realize I basically cheated people? I've lied, I've stolen, I've taken away people's resources. Please don't give me this role. They said, no, this is a role for you now to be basically the treasurer. So eventually he took the role and he found out that he could actually be trusted with the money, and the group in the community appreciated his service. And that's what Oxford House is about. It's about everybody living together in community. And the reason the Oxford House could go from one house to over 3,000 houses is because each one is democratically run and self-governing. And each house pays for its own bills. It pays for everything. And that way it can basically be an inexpensive way of spreading a recovery community to many others. And we know this opioid epidemic, as well as the pandemic that's occurred, affects people from different racial groups. And we know that those who are people of color generally are even more difficult situations with lacking basic ways of having stable housing. Let me give an example. We've done some work with jails and prisons, people coming out of there. And as you all know, many people who are in jail and prison are there because of substance use disorders. And when you ask someone coming out of jail or prison, like Cook County Jail, what are the two things that you're looking for? One thing is they're saying, well, we'd like a safe place to live that doesn't involve substance use. And two is we'd like a job. By the way, those are the two things that our society has the most difficulty providing. The over 600,000 people that are coming into our communities from jails and prisons each year. So what Oxford House does is gives them a place to live, and then basically says, we're going to encourage you to basically find employment. And there's people in the houses that will tell people of job leads. So in a sense, the Oxford House is a place in the community where people have an opportunity to connect with others, find a place to live, have their address, so mail can come to it, place where they can say they're living, so that they can basically have a better chance of getting a job, and have people in the house who act like a bunch of folks who are connected with other sources of employment. So it's all done naturally, organically, and that's what's exciting. So as I said, I'm a community psychologist. I'm interested in trying to understand how communities solve their own problems. Oxford House is one place where I think they're doing a great job. And what we're going to talk today a little bit about is what Oxford House gives back to its community. We're going to talk about some racial findings, particularly African Americans, and how they do in these particular recovery homes. And we're also going to talk a little bit about some Native Americans who have set up Oxford houses on their reservations and how those have gone. So those are a couple of things we're going to talk about today. And also a little bit about the Center for Community Research, where myself and Ted work. We focus on teaching, research, and service. For 20 years, we've been here, and we've had over 270 undergraduates have gotten into graduate schools by gaining credentials in our research projects. So we're actually doing teaching at our center. We're doing research, bringing in federal grants, and that helps support our staff as well as the university. And we also provide service. We're going to talk a little bit about COVID and how recovery homes can be an incredibly important housing stability outcome. It can be a place where people can actually live and reduce risk of getting COVID. And we'll provide some of our findings from that as well. So what you see here are 5 Oxford houses. They look like every house on a block. So there's nothing different, except that the people in these houses are in recovery. And also the people in the houses are completely democratically run. So every decision is made by the democratic vote. There's business meetings that held once a week, and people come together. So I would imagine that these houses on blocks are probably among the safest because there's no substance use occurring in them. And there's basically equality that's occurring in these houses. So this might be particularly important for those who have not had an opportunity to live in this type of middle-class setting. And some of these houses, for example, have swimming pools, and they look pretty good. So you're taking a person who has been in poverty and probably had, almost all of them have had criminal justice involvement, and most of them have had homelessness. And here you're taking those people and putting them into a middle-class existence with the middle-class setting, and people who are all working, people who are not taking drugs. And just think about how powerful those things are to an individual who possibly needs a second chance. That's what Oxford House does. And Oxford House is one type of recovery home that we've been studying for many years. There's other types of recovery homes too that are managed by staff. There's a lot of commonalities between them, but altogether, we're talking about over 250,000 people are living in recovery homes today around the United States. So it's a tremendous opportunity to provide low-cost housing for individuals and an opportunity to change the social networks of individuals and allow them a chance for recovery. So you probably say, well, you know, what happens to these people in the Oxford House? Do they actually help their neighbors? Do they help other people in the communities? And what we've found is that the typical resident spends about 10.6 hours on neighborhood involvement, very much involved in administering and running support groups. 56% were involved in educating the community about Oxford houses, and 36% were involved in educating the community on recovery. So you can see that the Oxford houses are a setting that are having these emanating effects across their communities. 39% of participants reported involvement in informing or advising agencies or local leaders, and 32% reported involvement in community anti-drug campaigns. And this included speaking at political events, attending community meetings, public hearings, and forums. Other general community activities, working with youth, fundraising, volunteering time with community organizations. So you can see that these Oxford houses are not just a place of healing within the house, but there's emanating effects throughout the communities to trying to make a difference for individuals in recovery. And when we asked them, do you think living in Oxford House increased your likelihood of involvement in your neighborhood? 86% answered yes. And I might add, as a training for the people who have been at DePaul, and I know that you're all alumni, well, Dan Choburn and was actually a research assistant at our center about 17 years ago. And he then got his PhD, and now he's come back to DePaul, and he's actually on the faculty of the School of Public Health. So you can see that we have that connection with training and teaching and giving back service for the people who work with us too. And Brad Olson, who's another one of the authors here, is now in the faculty at National Louis University. So you can see, and he was an undergraduate at DePaul. Other research findings, a significant positive relationship between length of stay. Those who stayed in Oxford House longer were more involved in the community. So that's a positive thing. So this is really one of our first grants that we got that looked at individuals who went either to an Oxford House or a control condition after they were in substance use treatment. And you can see that we then kept them over time. They completed treatment, 28-day usually. We approached 154 people to be in the study, 150 agreed to participate, and then we assigned them either to an Oxford House or not, and followed them. And we interviewed them every 6 months, and we kept almost 90% of our sample for 2 years to see how well this thing worked. And here's some of the results, because you always kind of wonder, well, it sounds good, but what's the data? And that's what we try to do. When we compared Oxford houses with usual aftercare without having a recovery home, we had 69% abstinence 2 years later versus 35%. In terms of monthly income, $989 for the Oxford House versus $440 without, they didn't have it. And incarceration was only 3% for Oxford House, 9% if they didn't have it. So just think, if we could basically have these types of results for thousands of people in recovery. And you can see these are just graphics of kind of showing abstinence rates, incarceration rates, and monthly income. And for all of these, you can see that Oxford House made a difference. And this particular study got disseminated throughout the United States. And that study helped validate Substance Abuse Mental Health Service Administration approved Oxford House as an empirically validated program. So we gave back to the Oxford House organization with the research that we did. And we also have been an expert witness, communities dealing with not in my backyard, NIMBY. And as you know, actually there's quite a few of communities that are a little bit hesitant of having people with substance use disorder live on their block. And we got a phone call from a court, and they basically said, well, they're trying to pass laws to stop these types of recovery homes like Oxford House from spreading. They're saying you can't have more than 5 people who are living in a house. And we did research very quickly and found out if you actually had 7 to 9 people in the house, you had better outcomes. And we sent that data to the judge, and the lawyer who was representing Oxford House used that data to close a case that had been going on for months, and basically said, well, gee, if you have a little bit more people in the house and you get better outcomes, why should we prevent Oxford houses from only having up to 5 people? So in a sense, you can see that our work has not only been able to affect SAMHSA, federal agency, but also the criminal justice system. And I might add that every court case that we've represented a community in, they've been successful in basically making sure that they could keep the house in those communities. Just another quick study on altruism. We went to an Oxford House meeting. Every year they have a national convention, and we present some of our research to them. And the person from the convention came to us and basically said to us, you ought to study altruism. You ought to study something besides just substance use, because what's important is how we change, not just the fact we're not taking substances. And I said, sure, I can understand. And he said, you see that woman over there? I said, yeah. He said, well, she has AIDS. And before I went into Oxford House, I wouldn't even talk to her because basically she was different than me. And what I've learned in Oxford houses is that I don't have to dislike people who have a different skin color than me. I don't have to dislike people who are different from me with having an illness like HIV positive or AIDS. I can basically care about the person and not just the external. So we said, why don't you study altruism? So we did that. We actually looked at residents over time to see, did they become more tolerant? And the results actually suggested that residents of these communal living settings had a superordinate goal of overcoming substance use. And it did lead to trajectories that were significantly improved for those who basically their tolerance actually increased over time if they had an Oxford House experience versus if they didn't. Some people have asked, what are the role of mentors in houses? Relationships with mentors are usually less formal than relationship with sponsors. The mentors give advice in recovery, share their experiences. Mentors also offer support on issues not related to recovery. So, social settings where punishment is often the objective, rather than restorative justice or development of peace-oriented skills and dispositions. So that's unfortunately characterizes lots of prisons and jails. When people leave these settings or substance use treatments, they need a safe place to live and a job, necessities most do not have. Many return to social networks of friends and family members that are abusing substances and not engaged in legal work. And when confronted with these types of social networks, few are able to escape these influences. And we know the opioid epidemic killed about 70,000 people a couple of years ago, and then it's up to 80, 90,000 people. So more and more people are dying of this opioid epidemic, particularly in times of COVID. And we know that the people who are being affected the most by the opioid epidemic, as well as by COVID, are those people of color. What's needed is low cost but effective ways of replacing social networks with ones that feature individuals who do not abuse alcohol and drugs and are employed in legal activities. Community network-based solutions include recovery homes where individuals can seek support with others from addiction. And just real briefly, a study that we had finished on COVID outcomes from March 2020 to January 2021. There were over 40,000 people living in Oxford houses during that time when the epidemic occurred before vaccinations were available. Only 4 people died of COVID during that entire time. Those are extraordinary rates. We looked at the communities around Oxford houses, and we looked at the Oxford houses, and we found that infection rates in Oxford houses were substantially lower than the surrounding areas. So just think what that means. We worked with a group of people who had high rates of substance use, prior disorders. Almost all had criminal justice involvement in the past. The majority had been homeless. A lot of them had psychiatric comorbidities, often depression or anxiety disorders. So here's a very high-risk group who are housing unstable, and yet it's turning out that Oxford houses is a place, an oasis in the community where people can actually be able to, not have to be at such risk for some of these deadly diseases. Okay, I'm going to turn things over to my associate, Ted, and he's going to talk a little bit about some of our work with Native Americans and with African Americans. Ted, I'll let you take over.
Thanks, Dr. Jason, for getting us started. And I could probably just say slide because you have the thing and that'll mean to change the slide. But right now I'm okay. I also wanted to thank April and Emily for hosting and inviting us to share some of our research. And I don't have all that much to add, but I'll elaborate with some examples about what Dr. Jason talked about in how we kind of work to equalize the racial injustices that are going on, especially in our little corner of research with Oxford House residents. So one study that we published in December of 2020, I think it was December 30th, it was published. We did a social network analysis of Oxford houses for Native Americans, who the house that we particularly looked at was opened on a Squamish tribal reservation that's located near Seattle, Washington. And we looked at individuals within the social environment of the Oxford House, where they were immersed in a social network. And we looked at a couple dimensions, being friendship, Dr. Jason mentioned mentorship, adversary, willingness to loan money, advice-seeking frequencies. Giving that little background, I'd like to jump back a little bit. Can you change the slide? About what a network is, so I could give a little bit of background on that and then address the results that we got from our study. So a network is basically a group or a system of interconnected people or things. And more specifically for our study, it's a set of dyadic ties across individual and relationship structures. What is a dyad, right? 2 points, any 2 points make up a dyad. And the language that we use in our studies, which might not be so relevant now, is an ego and an alter. An ego is the person for whom is looking out, and an alter is the person that they are rating. And that could be shifted, if it depends on who we're looking at. The alter can become the ego if we switch it around. But basically, it's just 2 points, which are the basic building blocks of a dyad. Slide. So there are several different network types that we would want to look at. One of them is a tree network. This one is okay. It's more of a business model network, right? If you flipped it over, it'd be a triangle. The person on top would be the manager, filter down to like the assistant managers, then down to the workers, right? And they're not as connected. Everybody's connected, but there's different ways that they're connected. Ideally for Oxford House, we'd like to see a ring type connection where, well, not really ideally, but a ring connection. You're always 1 or 2 connections away from the person that you want to go to. So say I want to connect with somebody on this, I'd have to go to 2 people to get to that person. Next one. The star one is a central figure where everybody's going to one focal point, right? Which is okay, but a little bit dangerous, because if that person in the middle is misinformed, everybody in the house is going to be misinformed based on that person, and it's easy to like get the attitude of this is the way it is. It's only my way or the highway. And stars work, but maybe not so much for an Oxford House. This is mesh is the ideal network connection type for an Oxford House. Everybody's connected to everyone else. I'm only 1 step away from everybody that I need to talk to. It allows a person to gain multiple perspectives on different things, and as we know, we all come from different backgrounds, and in an Oxford house, people from all different walks of life share one commonality: substance use disorder and their desire to get that into remission and become abstinent. And if you're connected to a lot of people, like in the mesh one, it's easier to get multiple perspectives on different issues and expand your horizons. So back to the Oxford House on the Native American study, we found that, like Dr. Jason mentioned earlier, that the tribal council and the Oxford House residents within the houses, they perceive these recovery homes as being very compatible with their values and norms. One example that we got, I also met some people at one of the Oxford House World Conventions. His name was George, and he shared with us some of the little nuanced differences that they needed to make, because every house is autonomous, right? They have some certain rules that they need to follow. You have to remain abstinent, pay your fair share, and contribute to the chores, and have refrain from any type of abnormal behavioral issues. But for the Native American houses, they had to do a couple things differently. For instance, when they were doing their weekly house meetings where everybody's expected to attend, in the Native American houses, they passed around a feather. And if you had the feather, the floor was yours and you were able to speak. And it cut down on people trying to compete for time to be heard. And as Dr. Jason mentioned before, these houses are democratically run. Everybody has an equal vote. So even the person that's shy and doesn't want to speak, their vote counts as much as the person who speaks the loudest and dominates the floor. For these Oxford houses in the native land, on the naval reservations, they would have a feather and the person who had the feather. Another difference was that people in typical Oxford houses are expected to attend 12-step meetings, self-help groups such as Alcoholics Anonymous or Narcotics Anonymous. For the tribal houses, they were also, the sweat lodge would also be considered as one of the weekly meetings that they need to attend. So these little, can you go back one more second? Yeah, and so particularly since their governance system was democratic, everyone in the house had an opportunity to be involved in the decision-making process. So when they were establishing these houses, everyone got to put in their input about how they would like to see this house run. And in terms of the tribal council, they would come over, visit, they would bring food and desserts for people. When they drive by and they'd see people on the porch, they would honk and wave. And they would specifically, these houses had at least 3 beds that were reserved just for people on the reservation. So they also brought in people, so they weren't excluding people just because they weren't affiliated with the Native American tribes. They just specifically had a couple beds that were designed just for people on the Native American tribe. Next slide. This is another study that we did, and is given the health disparities that exist between Black and Latin individuals versus their white counterparts, especially when they're trying to find treatment for substance use disorder. One route of intervention is to identify and examine the settings and resources that might provide these groups with community-based opportunities and resources that help lead to more equitable health outcomes. That was our motivation for doing this particular study, where we took the same social network analysis foundation and we explored health disparities among white, Latinx, and Black, the differences there between these minorities and majorities. But what we were looking at is that racial and ethnic minorities, they systematically experience more barriers when obtaining services, especially when they're white counterparts. And I was thinking about it earlier, like, am I even qualified to talk about this? I don't have any experiences being a person of color, but I decided that, like, the best thing I can do, right, is try to understand. And how do I understand? First, I start off by believing that these differences and these barriers exist. So it starts with that belief. And then we started examining, like, to understand better how we can help, like, knock down some of these barriers, right? And our study evaluated outcomes of community-based recovery support program, Oxford House, in both prior times in residence, which had a negative effect, but the longer they stayed, in Black ethnicity, which had a positive effect on predictors of recovery outcomes. So it looked like people who were in the minority in these houses were having better recovery outcomes. And we hypothesized that this was because the Oxford houses provided a communal living space. And this was very important to some people, especially people of color, or belonging to a community, like Dr. Jason mentioned, increased their chances of sticking around. And some of my research has also shown that it's just important to have someone that we can relate to, and it improves our chances, because when we stop thinking that we're unique or different from everyone else, we start exploring commonalities, and that commonality becomes a bond. And especially in an Oxford house, the commonality is I don't want to use drugs anymore. This seems to be working for other people, so they started with the belief maybe it'll work for me too. And proud to be part of this organization.
All right. Thank you, Ted. So let me just try to kind of summarize a little bit of what we have learned, and then we're going to open things up for questions from the audience. As Ted has indicated, that we actually found that African Americans not only stay in these recovery homes longer, but that they have better outcomes. So when you think about health disparities and trying to reduce them, here we have an intervention that seems to help everybody that comes into them, but that those who are most at risk, African Americans, tend to actually have higher improvements over time. And we have a number of studies that have actually found this out. We've also tried to set up Oxford houses for Latinos who are Spanish speaking and those that are basically non-Spanish speaking. And we found good outcomes for Latinos in both types of Oxford houses. We've also looked at Oxford houses for those who are hearing impaired, people that some cannot hear, and those houses also had good outcomes. In Hawaii, we've looked at some houses for transgendered people. And what we found is that they're an excellent place for people who have different sexual orientations, and they're completely accepted in those Oxford houses. So just think about what we're talking about. We're talking about something that does not cost the taxpayer, does not cost local, state, or federal resources, because these houses basically are self-supporting. There's no professional staff. Everybody in the house is becoming a leader and trying to basically help others in recovery. If it turns out that we have this incredible opportunity across the country to understand how community-based groups can help those with the pandemic, a safe place to live, can help individuals who are often homeless, people who are, in a sense, often coming out of jail or prison without any place to go. If recovery homes like Oxford House could be available even more places. So yeah, now there's available 3,000 recovery homes. What if there were 10,000 of these recovery homes available? Just think about what that could do for our society. So we're very excited, very privileged to basically witness what a group of people at the community level can do to solve problems. And that's what DePaul University is really about. From the founder, St. Vincent de Paul, was really about how do we help people help themselves. Can you think of anything better than the Oxford House? It's basically helping people with a stable living situation. So if Oxford houses can help people who have substance use disorders, isn't it possible that this same idea could be used for other social problems that we have? Just think about what the possibilities are. We have a healthcare and a mental health crisis going on in this country, with so many people needing services and not being able to get them, with expenses going so high. Well, what about community-based solutions, like a recovery home like Oxford House that's self-governed, for possibly people that are have other types of issues. I could think of something like, for example, chronic illnesses. There's a lot of people who have chronic illnesses who have no place to go, feeling totally isolated, don't have a sense of isolation. Do you know that loneliness is a risk factor as deadly as tobacco smoke? So we know that basically interventions that provide community, that provide social support is really what we want. Holistic solutions to basically help people that are not sort of siloed, where we're just working on one little piece of the person's overall problems, which I think is a real challenge for us as people who are social change advocates, as well as researchers, to try to make a difference. Thank you all. We're now open for taking a look at some of the questions. And we have our first question that has come in. And it is, are Oxford houses rented, leased, or owned? So that's a very good question. And we will talk about that. So Oxford houses are basically always rented. So basically they're never owned. And the reason for that is, say you own the house. If you were an owner of the house, you would have more privilege and more power than other people in the house because it's your house. So if you owned the house, you would not be able to live there because everyone in Oxford House are equals. And basically the power differential is one of the basic problems of many types of healthcare settings. And what Oxford House does is tries to level the playing field so that everyone has a vote, everyone has their input, everyone can basically participate like everybody else. So yes, Oxford houses are places where you rent, and rent is actually a very nice way of spreading this innovation. Because think about, there's quite a few houses that you can rent very quickly without having to purchase and have all the equity to make that money, to sort of purchase it or to do things with it that involve gathering that money. And once you gather that money, then there's another, liability for that particular group of someone possibly doing something with it that's illegal. So everybody, in a sense, is a renter. And the people who rent the houses feel very good because they have a stable source of income. So it's a win-win situation. The people who are the landlords, the people who are renting, they both get something out of it. And we have an innovation that has the possibility of spreading much quicker because of the rental feature. All right.
I wonder if anybody's thinking about what happens if somebody's coming out of jail or prison and they don't have money to pay rent right up front. Maybe you could say a little bit about what Oxford House members do for people that are unable to pay their first or second month's rent.
Sure. So a person who comes out of jail or prison often, has resource inadequacies. Sometimes they don't have a social network that is wanting to greet them to come back into it because they've basically done illegal things and cut off some of those sources. Sometimes they come back into social settings and they couch surf, or they go from place to place, or sometimes they're homeless. So there's all types of inadequate solutions. So what an Oxford House does as a recovery home is you can come into it, and the people in the house, once they vote you in, they recognize you don't have a job. So for the first couple of weeks, you are asked to basically go out and job search. And the house will basically allow that person to have that amount of time. So in a sense, it's a very good thing that the people who have the least resources, who are in poverty, have an opportunity, in a sense, to actually start off their life again, to basically have a place that's stable, where they have an address, where they can get sometimes their license, where they can get cards, that ID cards all the things that are needed to actually get employment. So that can actually help you stabilize the employment piece. And the other thing is, as I mentioned earlier, the other people in the house are all working. So if you surround yourself with people who are all working, what does that do? It's a good motivator for you to work. And those people who are all working have a variety of different jobs. And sometimes they can say, hey, I'm doing lawn service. We need another person on the team. Come on and join me. Or they might have something else in the service industry. So it's a great way of individuals getting hooked into a job so that they can start paying on their own. Now, you're right. Eventually, if the person went week after week without having to pay, they would be then ultimately asked to leave the house, because the house has to survive financially. It's a community, and each person has to basically take their share, kind of. And if you're not taking your share, then you basically are having a problem, and the house will ask the person to leave. So yeah, everyone has to be responsible. These are not wet houses. If a person takes alcohol or drugs, they're immediately asked to leave. So in a sense, this is not a place where people can stay and be like a wet house, which is a place where alcohol and substance use is occurring. They won't allow it. So yeah, there's very tight standards, and that's good, because what it allows an Oxford House to be in a neighborhood and have the best behavior, and that's why people like them. I still remember the first house in Arkansas that started up. This was a number of years ago, and it went into a small town in a rural area, and they rented the house. And the guy who lived in the house next to them was really upset that the Oxford House had moved into his community and was his next door neighbor. And he basically had a shotgun on his porch, and he kind of said, any of these folks act out or anything, I'm going to shoot them. So you can see the reception to the Oxford House for the first one in Arkansas was not very good. But a year later, after they proved themselves to be good neighbors, that neighbor was participating in a one-year anniversary celebration, and had become sold that and convinced that this was a good thing for the community. So yes, Oxford Houses can be excellent places to begin to change attitudes of people toward those who have substance use disorders. So it's a stigma reducing influencer in the community. We had another question that had come in when I was talking, and so here's the question. So thank you for asking this one. The question is, could the Oxford House model work in houses where residents do not share the same issues? For example, recovery, mental health, gender identity, domestic abuse residing at the same location. So the reality is that these Oxford Houses do have people with mental health problems. Something like almost 50% of them have some type of comorbid condition. There are many people who do have gender identity issues. As I mentioned, there was a house in Hawaii, and actually different sexual orientations are very welcomed in Oxford Houses. And in terms of domestic abuse, yes, quite a few people end up coming into Oxford Houses with domestic abuse histories. So I think the challenge is, could Oxford Houses work for people who maybe don't have substance use disorders? Because all these people have substance use disorders, so that unifies them in terms of something that's very consistent. I think kind of would be really interesting to see if the same model could work for other types of social problems or people who have difficulties with other things. You've got a lot of kids who are 18 who get emancipated. Where are they going to go? Could it work for those types of individuals? Could it work for people who are homeless, who have the capability of working? and we know some of them do. And if they could work, they could support themselves. And you could go on with different types of possibilities that could potentially be tried out, which would be very exciting. So yes, lots of places to potentially go. Ted, any comments on that?
One of my colleagues did, just one of the challenges that they faced was with veterans. So they had looked at houses that had one or more veterans in the house. And it turned out if there were too many veterans in the house, a military-esque hierarchy started evolving where, as Dr. Jason said, everybody's equal in the house. But with too many veterans in the house, there started to be a hierarchy where some people were taking over, and that kind of goes against what Oxford House stands for. That was one of the challenges of that. And my research looks at comorbidity with mental psychiatric comorbidity, actually. And it turned out that just having another person, if there was houses with only one person who endorsed having psychiatric comorbidity, their outcomes were less. Just generally, those people who have psychiatric severity or comorbidity issues, they tend to have a more difficult time just adjusting to things. But with the introduction of a second person into the house, they didn't even have to have the same psychiatric comorbidity. As long as they were in the house, both of their recovery outcomes improved. So their quality of life was better. They ended up staying a little bit longer. So like Dr. Jason said, would this model work for houses with people who didn't have a substance use disorder? I'd like to see that. But right now, integrating people of all walks of life, it is working. It's showing that it is. But then there's also challenges that come along with it if too many people are the same. That's probably the strength. The diversity is the strength of these houses. So having too many people that would be alike might just foster likeness, which is okay, but also the negative stuff. So it's nice to have multiple perspectives in the house, which is, I think why this model is so successful.
Ed, do you want to tell people just a little bit about what your dissertation is about?
Sure. So like I said, my thesis was about the finding that at least having one other person in the house changes both outcomes for the better. I decided in my dissertation to take that a step further, and I learned how to do some social network analysis. And the cool thing about the data that we have data from both perspectives. So say I'm in an Oxford house and Dr. Jason is one. He reports stuff about me, like if he's willing to loan me money of $100 or $500, that to us means that he would trust me. Usually psychology would stop there, right? We have the perspective of one person. Social network analysis allows it to also say, do I trust Dr. Jason with $100 or $500 loaning? So now it's reciprocal. So now I'm able to find out if just having the person with the psychiatric severity, the second one in the house, do they need to be friends? Are they willing to loan each other money? Do they go to each other for advice? And it looks like, based on the preliminary analysis that I've done, it looks like they do go to each other for advice, and they are willing to loan each other money. I didn't find anything with the friendship network, but the other two might be precursors for friendship network. Another reason that I've discussed in my discussion section is maybe these people are brand new in the house and the friendship hasn't had time to form yet. But by being able to loan them money and going to them for advice, those are the building blocks for a relationship. So maybe later on, I'll talk about in my discussion section, more research is needed to see even further down the line, do these people also become friends as a result of their loaning and advice seeking habits, So I think that's kind of where I'm headed with my dissertation. We have another question, it looks like.
So this will probably be our last question since we're kind of approaching our hour. And the question is, this information stories are so encouraging. How can we support the Oxford House mission and intention? What is the best way to share this information and contacts with social services groups in my area? Well, just to let you know, you might want to do a search for Oxford House on one of the browsers, and you'll find their Oxford House homepage. And if you go into that, they actually have a list of all the Oxford houses in every state. and the addresses and the contact people, as well as whether there's residencies open. So if you're particularly interested in learning about an Oxford House that's in your community, you can find it from the Oxford House page. You can contact the Oxford House, and you can possibly go and actually meet some of the people in that house. Each house, in a sense, is connected with about 10 or 12 other houses in what's called a chapter. And the chapters meet once a month. So that's another opportunity to meet a group of people who are all in recovery. And the state then has an organization of the different chapters, and the different states come together and they basically work with what's called the World Council that basically oversees and governs the Oxford House organization. Paul Malloy is the person who started this organization with others in 1975, and he's still basically leading. And Kathleen Gibson is also in a very high leadership role within the organization. So Oxford House has an 800 number. You can call them up and you can talk to people directly. And thank you all for participating. We're just about out of time, and I just want to turn things back to Emily and thank very much Ted for participating on this session with us. So thank you, DePaul, and I'll turn things back to Emily.
Well, thank you both so much. It was a very, very interesting hour and a lot of great insights and a lot of really interesting research. I'll also share, if you're interested in learning more about the Center for Community Research, if you go onto the College of Science and Health page, there's more information there that you can explore some of the great work that both Dr. Jason and Ted and some of their colleagues there are doing. So we will wrap it up, but thank you all so much for joining us. Of course, if you have any other questions or want any more information, you can also email us at dpalumni@depaul.edu or alumnievents@depaul.edu. So we are at our hour, but again, thank you all for joining us. Thank you to Dr. Jason and Ted, and hopefully we'll see you all soon.